Welcome, everybody. Today, we're going to talk about older adults and suicide risk. My name is Heather Hughes. I'm a licensed master social worker, and I'm the older adult behavioral health PASAR specialist for Central Region.
Good morning. My name is Mia Rigsby, and I also am a licensed master social worker, and I too am an older adult behavioral health PASAR specialist for Southern Maryland.
We wanted to talk to you today regarding older adults and suicide risk. This is a very important topic that gets underreported and underdiagnosed. And we wanted to talk about why it's underreported and underdiagnosed, give some resources, and just make sure that you have some knowledge of some warning signs or risk factors for a loved one or a friend or a family member that you may think may be at risk for suicide. So let's talk about some suicide statistics. Nationally, the suicide rate is highest for non-Hispanic white males over the age of 85. And currently, suicide is the 18th leading cause of death for ages 65 and older. Now, as we know, and if you listen to our last presentation, we know with the COVID-19 pandemic, this may be increasing, unfortunately. There's a lot of reasons why that contributes, and we'll talk about them later in this presentation. And in 2017, over 3 times as many people died by suicide in Maryland than in alcohol-related motor vehicle accidents. That's just astonishing. And I do want to direct your attention to the graph over here. This is comparing deaths by suicide from 1999 to 2014. And as you can see, when you get to the age about 45, right, you can see that the deaths by suicide increased. As you see, it sharply increased from 45 to 64, and it just continues to trend that way. The suicide rate has increased by more than 30% since 1999, according to the CDC. And older adults account for 12% of the US population, but account for 18% of the suicide deaths. Now, we do know that the older adult population is rising. By 2030, they're going to account for about 18% of the world's population. So it's pretty safe to assume, based on this statistic, that also the suicide deaths will also increase. And statistics from the National Council on Aging state that those 85 years and older have the highest suicide rate of any age group. It is over 4 times, let me say that again, 4 times higher than the nation's overall rate of suicide. So when you're thinking about your loved one or a friend, just kind of keep the statistic in your head, right? If you start to notice changes that we're going to talk about a little bit later in this presentation, it may be worth reaching out, talking to them, getting connected to a clinician, just to make sure that your friend or your loved one is doing all right and doesn't need to talk to anyone, go to the hospital. There's nothing wrong with going to the hospital if they're struggling with thoughts of suicide at all, but it's important to know the signs and symptoms. Mia, would you like to take the next slide?
Absolutely. So also, suicide attempts, they are often more lethal in older adults. And when I say they are often more lethal, older adults tend to actually go through with the act of suicide. Older people who attempt suicide, they're more frail, they're more isolated, they are not around their family, they're not around their friends. They often have a plan. They know that they're either what method of suicide they're going to accomplish. These factors, they suggest that older adults are less likely to be rescued and more likely, unfortunately, to complete suicide because they have the plan, they have the means, they know what they're going to do. Also, firearms are the most common means of suicide in older adults, with 67% of deaths by suicide completed by a firearm, followed by poisoning. And when I say poisoning, I mean over-the-counter medications, I mean other stuff that they may take Also suffocation. 12% of deaths by suicide occur with suffocation. Also, older adults are nearly twice as likely to use firearms as a means of suicide than people under the age of 60. They have licenses. They have a right to have a firearm. So they know that it's there, unfortunately. This scale right here, it's a pie chart, and it shows you the breakdown of means of suicide by older adults who are age 50 and over. As you can see, the biggest part of this pie is firearms. Then we have suffocation. Then we have a fall or jump. Then we have poisoning, and the other is cut or pierce, and last is other. And so over 70% of older adults have visited their doctor within the past 30 days. They have seen their doctor, and the doctor has not been made aware of, or the doctor has not asked the necessary questions, or somehow or somewhere along the line, our older adults have slipped through the cracks, and they have actually committed suicide within the 30 days of seeing their primary care doctor. So we urge everyone who comes in contact with our older adults, whether it's at the doctors, with the medical assistants, with the nurses, with the social workers, with the doctors, someone needs to ask our older adults, how are you feeling? It's very important. Just a simple, how are you feeling today, could change their whole trajectory of thought.
And it's also very important to note here that older adults may complain of physical symptoms. They may talk about the emotional symptoms of what's going on. So they may start to say, oh, my back hurts more, or my shoulder hurts, or any physical symptom. And if you hear your loved one or a friend of yours start talking more and more about physical symptoms, you may want to reach out to their doctor, or have them reach out to their doctor, or have someone that they can talk to, because they could be struggling with suicidal ideations or suicidal thoughts. So it's very important to note that they may not come right out and say, I want to die, or I'm thinking about suicide. They may complain of the physicality symptoms of it. And this is why one of the reasons that older adult suicide is unfortunately underreported and underdiagnosed, because the doctors, to their credit, they're not connecting the physical symptoms with the emotional symptoms of what's going on. So let's talk about some risk factors. We do know that depression is a risk factor. I want to be very, very clear here. There's a misconception that anyone who has died by suicide has to have had a mental illness, and that is extremely untrue. Many individuals who have died by suicide have no known mental health condition, but we do know that depression is a risk factor. We also know prior suicide attempts. Family discord or losses, a recent death of a loved one, whether it be a partner, a spouse, even a family friend, if they were close enough. We know alcohol or medication misuse or abuse can also raise risk factors, right? If you have just recently had surgery and have been given very powerful pain medication, sometimes it's very easy to misuse or abuse that. And we do know that with our older adult population, we are seeing medication misuse rise. Medical issues that limit functioning or life expectancy. So if anyone that you know has gotten a terminal diagnosis recently, you really want to be checking in with them, or make sure that they are connected to a clinician, because that definitely is something that they're going to want to talk about. Chronic pain. If you've ever had any kind of chronic pain in your life, you know how distressing that can be, and how painful that can be. Now, just imagine living with that day in and day out. Declining role function, loss of independence, or sense of purpose. So this is one that I especially want to keep us aware of, right? When we get older, we don't expect to have a loss of independence. I will just speak for myself. As I age, I hope that I'm able to stay in my home, that I'm able to do everything that I am currently doing here. I don't anticipate needing help later on in life. That's not something that we go into aging thinking we're going to need. And so when someone has a loss of independence, that can be very traumatic to them. It can almost be like the loss of a role, right? You're no longer able, you need a caregiver. Imagine how distressing that could be to someone. Social exclusion, older adults are no different, especially with exclusion. If they're going to the senior centers, we know that we want to keep them engaged. We don't want them to be sitting by themselves and isolating from one another. We want them to get involved. And we also know a cognitive impairment can increase the risk factor. Now, I do want to make a side note right here. There are some studies that say actually the highest time or risk factor for a cognitive impairment and suicide risk is actually during the initial diagnosis, because they're still able to have their cognitive functioning. And as the cognitive impairment progresses, that risk factor gets lower and lower. So again, overall, what we really want you to be aware of is that there are a lot of different risk factors, some of them being medical risk factors, some of them being emotional risk factors, some of them being social risk factors. So just be aware, these are the most common. Of course, this is not a full comprehensive list, but this is a good basis for you to kind of go off of. And just remember, just because someone may have one or more of these risk factors does not mean that they are going to attempt or complete suicide. Mia?
So some warning signs that we should be aware of, professionals, family, even individuals. Some warning signs include loss of interest in things or activities that are usually found enjoyable. So if our older adult who used to go and sit in the Burger King every morning with their friends, and they're not doing it anymore, that's something to be aware of. It could be a warning sign. If they're cutting back on their social interaction, they're not going out, they're not going bowling, they're not going to the dollar store, Walmart. You notice some self-care and grooming, they're not shaving anymore, or it may be a smell about them. That could be a warning sign. They're not going to the doctors, they're not taking their medication, they're not eating or going off a diet. You know, we're always dieting in some way or another. And if our older adults, they're not, doing their normal routine, then that could be an issue. That could be a warning sign for thoughts of suicide. As Heather stated in the previous slide, experiencing the loss of the personal loss of a spouse or a family member or a friend or even a pet. Our pets become our families. That can cause some distressing signs and symptoms and thoughts of suicide. Feeling hopeless, feeling like you're not needed, feeling like your family doesn't want you, or feeling like you're a burden to your family. Some people don't want that. We want to still be able to walk. We still want to be able to think for ourselves. We want to be able to use the bathroom for ourselves. And unfortunately, sometimes when we get older, we are unable to take care of our hygiene. And so some people don't want to be a burden to others. And this could be a warning sign of possible thoughts of suicide. Or maybe they're putting all their ducks in a row. Suddenly a person has made a will, or they've gotten life insurance, or they've made burial plans. These could be warning signs. We want to be aware of all of the warning signs so that we can look at our older adults and we can say, oh man, maybe, we need to spend some time with our loved one, or we need to take them to the doctors. They could be stockpiling medication or obtaining other lethal means for possible suicide. We want to always be aware and attuned to our older adult, to our loved ones, so that we can be an intervention in ourselves. And if someone expresses an intent to of suicide, we want to listen. We want to take them serious. We don't want to just say, "Oh, you don't know what you're talking about." This is serious. We want to make sure that our loved ones, our older adults, get the help and the resources that they need, so that they do not go through with death by suicide.
And it's also, Mia, as you stated before, it's also very important when someone makes a statement like that: I want to die, I want to commit suicide, whatever they're saying. It's okay to be nervous. It is. As a professional myself, I have been in these situations and they're always very scary. We're going to give you some resources later in this presentation just for you to save in your phone, so you have, if someone you know or even yourself is struggling with suicidal thoughts. So we want to make sure that you have those resources, because we know this can be a very, very scary conversation. And it can be also a very scary time for many individuals. And also, as Mia said before, the cutting back social interaction, self-care, and grooming, that could be a passive way of suicidal intent, okay? So there's just a little bit of difference. If someone's coming right out and saying, I want to die, or I want to use a firearm to hurt myself, whatever it may be, that's a very direct statement. But if they're starting to not groom themselves, do their hygiene, self-care, maybe they're not getting up anymore, so they're just laying in bed, that could be a passive warning sign. So it's just something for you to kind of keep in mind. So we wanted to also talk about protective factors when it comes to suicide prevention. We know that effective behavioral health care is a protective factor. As I stated in some previous slide, not everybody who has died by suicide has a known mental health condition, but we do know that if we have effective behavioral health care and that people can become connected to licensed clinicians and counselors when they're experiencing distressing symptoms, that can be a protective factor. We also know connectiveness to individuals, family, community, and social institutions can help a lot. We all want to feel like we belong to something, right? We don't want to feel like we're kind of on a boat by ourselves. We want to feel that we're connected to our family, our friends. Sometimes our friends become our family. Life skills. We know problem-solving skills and coping skills, ability to adapt to change, that all can help an individual. I am sure everybody who is watching this, and including myself and Mia, we all have had obstacles in our life, and we've had to adapt to them, some more challenging than others. So our ability to adapt to change and how we cope with that change can be very important. Our self-esteem and a sense of purpose or a meaning in life is also a protective factor. Again, it all goes back to wanting to be part of a community. We want to feel that we're a part of something. So having a sense of purpose, just because you're an older adult doesn't mean that you lose your sense of purpose. You could become the family historian, a cultural historian, right? You could be passing down traditions and recipes, right? That's still a sense of purpose. And cultural, religious, or personal beliefs that discourage suicide. Now, I do want to be very cautious when I say this, right? Because I don't want it to come off that anyone who is religious, and if their religion discourages suicide, that they're kind of quote unquote immune from suicidal thoughts or intentions. But we do know that cultural beliefs, again, that sense of community, sense of connectiveness, religious and personal beliefs can also be a protective factor. Mia?
Awesome. So if you or someone that you know and love are thinking about suicide, here are a few resources. We want you to please call the National Suicide Prevention Hotline with the number right here attached, 1-800-273-8255. Or please call 211. 211 is the Maryland gateway to all resources in the state of Maryland. They have so many programs, so many resources that can help anyone dealing with anything, including thoughts of suicide. Also, please call 911. Now 911, they have training, they have social workers, some districts, they have people who can come out and help in the moment of crises to help with thoughts of suicide. Please write these numbers down. Remember these numbers. Store these numbers in your phone. These can be very important to help saving someone's life.
And we do not want you to become the clinician. When you call these numbers, you will be connected, or your friend or your loved one will be connected to a licensed clinician who will talk to that individual and be able to give them resources or connect them to the hospital or get them attention at the hospital. So again, please save these numbers in your phone, like Mia said. Call the suicide prevention hotline, call 211, press 1, call 911, or call the mobile crisis team in your area. Mia and I just want to thank you for listening to our presentation about suicide and older adults. We know this is a very sensitive topic, and we understand that this brings up a lot of emotional feelings for everybody. So please, if you or a loved one or a friend is struggling with thoughts of suicide, please get them help. Please get them connected to someone. They are not alone in this. I know sometimes it may feel like we are alone, but we truly are not. So please reach out, call, get help. Do not just stay there. And please just know you are not alone. Mia, would you like to say anything?
Heather, you covered it all. Thank you so much for your time. We hope that you learned something and took in some valuable information.
Thank you.